All right. Good morning, everybody. Dr. Rafich, Vet Triage here. Another journal. We're gonna be the same one, JAVMA, from December 15, 2017. We're gonna do the article in Pathology and Practice right there. Boom. And so let's go through it. So this is a case of a 5-year-old Belgian Malinois who showed up to the veterinarian for ulceration and crusting of the mucocutaneous junctions, the nasal planum, and ear margins. So first off, the ear margins, you can see where I circled there. He's got crusting of the tips of his ears. And then the mucocutaneous junctions are areas like where the lips meet the gums, for example, or where the nail beds meet the digits itself. The inside of the nose meets the outside of the nose. Those are mucocutaneous junctions. The muco meaning the mucous membrane, and cutaneous being skin. And then nasal planum is the central part of the nose. So we had hyperkeratosis of those areas as well as the foot pads. So hyperkeratosis is an increase in keratin. Keratin is that tough tissue that you can feel on the paw pads of dogs, and hyperkeratosis means an increase in keratin production. So a lot more thicker tissue. And keratin normally is dead tissue. That's why it's so tough. And so there's just an excess of that dead tissue. So this dog also was not eating well, had weight loss. He was drinking a lot, peeing a lot. On examination, he had enlarged lymph nodes and possibly a large spleen. He had been in Afghanistan in the past because he's a military working dog, and also had a history of exertional hyperthermia. Now, exertional hyperthermia will have nothing to do with this case, but it's a condition where in some dogs, they work themselves so hard that they get really high temperatures, like 104 to 107 and beyond. And it's kind of normal in some dogs. The Belgian Malinois, Golden Retrievers, they just, something about them, I don't know whether it's genetic or what, but they work so hard they get themselves into almost like a heat stroke scenario. It's crazy. So the solution for that is just have them stop being active in that regard. They did blood work, which showed azotemia. So azotemia is defined as an increase in nitrogenous substances. And on the blood panel, azotemia is characterized by an elevation of BUN and creatinine. Creatinine is one nitrogenous substance in the body. It's filtered by the kidney. And then BUN is blood urea nitrogen, which means an increase in urea, which also is filtered by the kidneys. However, you can see elevations in both of those values in other conditions as well. So, but when you see an elevation of both BUN and creatinine, you call that azotemia. Now, azotemia, for those who don't know who are watching this, it's characterized, or it's divided into 3 broad categories as far as what the cause is. There's pre-renal azotemia, which is disease before the kidneys, most commonly dehydration or hypovolemia. The second cause is renal azotemia, which is related to the kidney itself being the problem. And the third is post-renal, which is anything that's causing a backup of urine from the urinary bladder, ureters into the kidney. And of course, you could have a combination of all 3 of those things. So this dog has azotemia, and because the dog also had a low urine specific gravity, meaning that his urine was dilute and he had protein in the urine, it was suggested he at least had renal azotemia as the cause. And the reason for that is with low urine specific gravity, it tells you the kidneys are not doing their jobs. They're not concentrating the urine adequately, and they're allowing protein to leak into the urine and causing the proteinuria. If you have pre-renal, usually the urine concentration will be higher because the patient is dehydrated. And if it's post-renal, they usually won't be producing much urine anyway. And they should have probably normal urine-specific gravity if they are producing enough urine for you to collect, if it's post-renal azotemia. The dog also had hyperglobulinemia, which is high globulins, and hyperproteinemia, which is high protein. So those are two findings that you consider due to inflammation and protein-losing nephropathy. So inflammation because something's going on with this dog, right? He's got these hyperkeratotic lesions on his skin, and protein-losing nephropathy simply means that there is a protein loss, protein losing. Nephropathy is because the kidneys are damaged. Nephro being nephron, which is the subunit of the kidneys, and pathy meaning disease of. So they took samples of the spleen under anesthesia. They did finite aspirates of the spleens. They collected cytology, submitted to the lab, and they found leishmania infantum. So leishmania is a zoonotic protozoal disease. So first off, leishmania, we don't see too much in the US. It's very rare. We do see it in the Middle East and other countries. And so this dog was deployed to the Middle East, so that kind of makes sense. The disease itself is caused by leishmania infantum. That's Leishmania. Infantum is Infantum. That's the genus and species, and it's a protozoa. So there's 4 different types of organisms that we recognize microscopically: viruses, bacteria, fungal, and protozoa. And it's zoonotic, meaning it can spread from animals to people. So humans and several other animals are susceptible to the infection, and it causes these skin issues as well as visceral disease. Visceral means anything in the any organs in the body. And here's an example of the cytology there from the spleen. You can see it's a macrophage. That long arrow is pointing to the organism, and that tiny arrowhead is pointing to a immature stage of the organism in the cells. So rare cases of leishmaniasis in dogs have been reported in the U.S. who have not had a travel history, but usually travel history is what you're looking for with them. So when leishmania infects the patient, it has to get through a vector called a sandfly, which is a bug that they have in the Middle East. The sandfly deposits promastigotes. Promastigotes are the early phase of this protozoa in its life cycle. Promastigotes then turn into amastigotes, and that happens within the macrophages. Macrophages are part of the immune system in our bodies normally, and in the actual macrophage itself, there's an organ called a phagolysosome, and that's where the promastigotes become amastigotes in the macrophage. And then because this disease is protozoa likes macrophages, it'll travel to characteristic parts of the body, most notably the bone marrow, the spleen, and lymph nodes. You could also have rarely eye disease, skeletal disease, neuromuscular or neurologic disease. So this is indicative when the host is infected with leishmania. It's indicative of what we call type 3 hypersensitivity. So in dogs and people, there are 4 different types of hypersensitivity. Type 1 is one we all think about, where you have an allergic reaction to something. So that's often due to mast cells being involved, eosinophils being involved with an allergic reaction. And type 2 is when the cells of your own body have antigens on it. Antigens are proteins that are attracting your white blood cells to then attack that cell. That's type 2, and that usually you see with conditions like immune-mediated thrombocytopenia or immune-mediated hemolytic anemia. Type 3, which is what we believe this dog has, is where antibodies and antigen bind together and they deposit in specific areas of the body, most notably, especially in this case, kidneys, but it can also deposit in like joints too. And then type 4 is what's called a delayed type hypersensitivity. These are cell-mediated hypersensitivities as opposed to the ones that were mentioned before, which are humoral or antibody-related. And you see it in more chronic conditions. We notice it more when there's been blood exposure of the mother to the fetus in utero, and then the fetus has a rejection of the blood that has been carried over from the mom into the fetus. So type 1 is your typical allergic reaction by mast cells, and that's where you get itchy and stuff and from allergic reaction. Type 2 is due to the cells of your own body, the white blood cells attacking your normal cells in the body that are deemed abnormal by the body itself. So it's immune dysregulation. Type 3 is antibody and antigen deposition in certain parts of the body, like kidney and joints. And type 4 is more chronic. It's a cell-mediated hypersensitivity that usually we see with like pregnancy in animals. Okay, so this dog has type 3, which is immune complex deposition, results in glomerulonephritis. So glomerulus is the organ part of the nephron that does a lot of the filtering for the kidneys. Nephritis is inflammation of the nephrons, which makes up the kidneys, like we mentioned. But you also can get polyarthritis, which is arthritis in multiple joints. And of course, if you have immune deposition, like we said, in joints, you'll get arthritis. So genetic susceptibility and immune status of the host, as well as the parasite virions, have roles in disease development. And typically you can diagnose this from cytology, like we saw in this case. You can do cytology of the skin, the bone marrow, lymph nodes, spleen. You're looking for amastigotes in the macrophages. You can also do serologic assessment, PCR assays, and biopsies or histology as well. So this dog was found to have a positive PCR for leishmania. And leishmania is the organism. The disease itself is called leishmaniasis or leishmaniosis. Let's see. And then of dogs that are affected, 72% have high protein levels when you talk about glomerulonephritis. So because of this risk, dog handlers in Afghanistan provide with topical parasitides. So chemicals that'll kill the sandfly. That's how you prevent this disease. So there are medications that include, and these are not ones I'm familiar with, but imidacloprid is one, permethrin is the second one, pyriproxyfen is another one, and deltamethrin impregnated collar for the dogs. All those medications help with repelling and killing sandflies. When you have a patient like this who's affected by the disease already, you treat the proteinuria, so the protein in the urine, and you give them an anti-protozoal agent called allopurinol. So if you're trying to prevent the disease, you're preventing the sandflies from attaching to the dog. If they have a disease, you have to fight the parasite, the protozoa. And then in this dog, the skin and mucocutaneous lesions, as well as a enlarged spleen, resolved since the treatment. So that's it. That's the case for today, canine leishmaniasis. Hopefully that was useful for you folks. Remember, it is zoonotic. So if you have a case that's suspected for that, make sure that you are trying to take all the antiseptic measures to prevent that disease from spreading to people. So, all right, perfect. This is September 27th, 7:18 a.m. Pacific time. I will be back on tomorrow for another live stream. Thanks for everybody who watches. Take care.